Welcome. We'll get started in a few minutes. All right. Okay, let's get this started, everybody. Welcome, welcome. I am Megan Claire Chase, and I am Share's Breast Cancer Program Director and host of our BC Life podcast. Plus, I'm also an invasive lobular breast cancer survivor. And also, since it's Ovarian Cancer Awareness Month, my mother is an ovarian cancer survivor. I am so glad that you are joining us for today's webinar, Mouth Matters, Oral Health Before, During, and After Cancer Treatment. Now, before we begin, I'd like to tell you a little bit about Share Cancer Support. We are a national nonprofit dedicated to providing education and support for anyone affected by breast or gynecologic cancer, as well as community outreach. We recognize that cancer affects every community, so our programs are inclusive and welcoming to individuals of all races, ethnicities, ages, gender identities, and sexual orientations and backgrounds. In addition to webinars like this, we offer support groups, support lines, outreach, and navigation and other free programs. You can learn more by visiting our website at sharecancersupport.org. And at Share, we believe that no one should face cancer alone. Whether you've come here to gain knowledge, to feel understood, or to connect with others, you belong here. So before we dive into the program, just have a few quick reminders for you. So all participants will be muted during this presentation. After the presentation, we'll have our Q&A. You can submit questions at any time using the Q&A box located at the bottom of your screen. Please remember, our speaker cannot give medical advice, so keep your questions general, and closed captioning is available. Click the live transcript button at the bottom of your screen to enable the subtitles. This webinar is being recorded and the link will be emailed to all registrants and posted on our website in a few weeks. And I also want to make sure that I give a shout out to our partner, Unite for Her, who put me in touch with our fabulous speaker today. So now I am excited to welcome our speaker, Jill Meyer-Lippert. Jill, the screen is yours.
Awesome. I appreciate so much the opportunity to join you. Just going to pull my slides up here. All right. So as mentioned, my name is Jill Meyer-Lippert, and I am a registered dental hygienist. I started my first job in the dental field in early summer of 1992, and I began my dental hygiene courses later that summer. But almost at the same time as starting that job, my mother was diagnosed with breast cancer. So I got to see firsthand all of the problems that she experienced inside of her mouth during treatments. And I remember her having such dry mouth. She was so uncomfortable. She'd actually choke from her tissue sticking together, but it hurt to even drink water because she had these huge mouth sores. And she was so sad when she went to her oncology team to ask what she could do. And they basically shrugged their shoulders and said, there's nothing you can do. This is just part of treatments. You just need to deal with it. So of course, I thought, now I'm working in the dental field, I'm going to save the day. But it didn't take long for reality to hit that not only did she as a patient not have the information that she needed to help improve her situation, her oncology team didn't really have the information they needed to help her, and the dental team didn't really have information that we needed to help her as well. So it was easy to see that there was a lack of care in this area and a disconnect in communication between the medical field and the dental field that was leaving our patients with a lack of information. And sometimes what I found is it was not only inadequate amount of information that patients were receiving, but also inaccurate information. Because one of the ways that I decided I was going to learn about the subject is really by questioning patients at the practice where I worked. And everybody who came in, I would ask if they had cancer on their medical history. What kind of treatments did you have? What problems did you have in your mouth? What did you find that helped you? What didn't help you? And I started to notice these patterns where not everybody who was diagnosed with cancer noticed problems in their mouth, but a lot did. And for those who did, very few reported that they were given adequate information, that they felt prepared for what they were going to be dealing with. And even fewer reported getting any type of information of things they could do to possibly prevent or manage the issues. What I was very surprised about is one of the patients at the practice that I worked at, she was a longtime survivor that unfortunately had a recurrence, and the type of treatment she was receiving allowed her to come in for her regular cleaning appointments. So when I had the opportunity to see her back, my first question is, are you having any problems inside of your mouth? And she said, oh my, yes, my medications are making my mouth so dry, but it's okay because the nurses told me to suck on lemon drops, and that really seems like it's helping. And I was just shocked. From a dental perspective, having somebody with a dry mouth, having frequent exposures to an acidic, sugary substance like lemon drops is one of the worst things that you could do dentally. So it was no surprise that a lot of people were getting through their treatment successfully, only to have a lot of damage done to their oral health. So that was really a motivation to me to learn more and try to help the patients in our practice. Fast forward to 2004 in the fall, my dad was diagnosed with his second cancer. He was a longtime survivor of chronic lymphocytic leukemia, and then he developed Hodgkin's disease, and unfortunately, he did not pull through. So in the spring of 2005, after losing him, this really motivated me to do more. So I started a volunteer program at the local oncology department where he received his treatments, where I created goodie bags that were very simple. They're just little, at that time, little paper lunch bags that were colored, and they had product samples in there. They had information, and it was something simple that patients could go home with right away as they were beginning treatments, and they could just start using. They didn't have to go from store to store to try to find different things. And it's just a simpler way for them to get the information. This is a more modern example of the goodie bags that I create. But I was able to keep that program going from 2006 until about 2010. Donations for the products were starting to run low and the bags were getting smaller and smaller. So I knew that I either had to just stop doing it and forget about it. And the thought of that really broke my heart, or I could take a leap and try to expand it in some way. So that is what I did. And that is how the idea of developing Side Effect Support came about. This is an online resource that I created that is meant not only to be a resource for patients and for family caregivers, but also for medical and dental providers to help get us more on the same page. So we are consistent about the information that we are giving patients, and not only keeping in mind those short-term effects. We want to have, of course, the treatment process more comfortable. We want to reduce infection risk during the treatment process, but we also want to preserve long-term oral health. And we want to think about quality of life long into survivorship, and having good dental health is part of that. So I just want to go back and really give some basics about oral health. These are some fast facts from the CDC, and oral health, unfortunately, many times is thought of as being a cosmetic issue, and it's so much more to that. It's essential to your general health and well-being, not only because of pain and infections, but because of social interactions. We need it to eat and speak properly. It can play a part in relationships, in employment, in the ability to just continue to smile. So they have found that people that lose that ability to smile and refuse to let themselves smile because of embarrassment of their teeth or the way maybe their mouth smells, actually have higher rates of depression and issues like that. So what makes one person have a healthy mouth and the next person not have a healthy mouth? what we are learning that a lot of it has to come down to what is called the oral microbiome. You probably have heard a lot about the gut microbiome, how the makeup of the different bacteria and organisms that live in your stomach can play a big role in how healthy you are. And the same is true for your mouth. Your mouth contains over 700 species of organisms, and some are good, and we need those to have oral health, and some are not so good. And those are the ones that are causing the cavities, the gum disease and problems like that. So our goal is really to have the good bacteria outnumber the bad bacteria and having that better balance. So sometimes there's this philosophy in dentistry, unfortunately, that we're just going to go in there to kill all the germs. But when you're killing the negative bacteria, the problem-causing ones, whatever substance you're using to do that, like a really strong alcohol-containing mouth rinse or things like that, that can't distinguish between the healthy bacteria. So it unfortunately will start to kill those too. So we want to find ways to nourish the good ones so they outnumber the bad. So some of the biggest problems with oral health, one, we're going to look at cavities. So it's helpful to know the anatomy of a tooth. And this is kind of a silly analogy, but if you think of a tooth like a peanut M&M, so the hard coating of the M&M, that hard outer shell, is to the enamel. That's the hardest part of the tooth. Underneath that would be the softer chocolate of the peanut M&M. That is called the dentin layer, and that is a softer substance that makes up a tooth as well. On the middle, the peanut of the tooth is your pulp chamber, and that's where all the blood vessels and the nerves enter into the tooth, and that is what gives the tooth life. So if you look at, I have a cross-section of a tooth that shows a cavity, and I also have x-rays on the right-hand side where on those radiographs, you can see areas where there is an arrow that shows a dark kind of triangular look. And that is a cavity that is starting in between the teeth where the teeth are touching each other. What we want to do is if a cavity starts is to catch it early while it's in that hard outer coating, that enamel shell of the tooth. Once it breaks through that, now it's into that softer dentin layer and it can spread a lot faster. If it's able to reach the pulp chamber, the middle peanut that has all the blood vessels and the nerves in it, that's when we become really limited on what we can do to help fix that tooth. At that point, if it reaches the pulp chamber, we basically have two choices. We can do a root canal procedure where we make a hole in the tooth and go in with little files and remove all of those nerves and blood vessels in the tooth and fill it up with a filling material from the inside with the goal to hold on to it. Or we can take the tooth out. And that's pretty limited on your choices. So that is one reason that having dental x-rays done on a regular basis is so valuable, because if something is starting, we can catch it a lot earlier and find it, especially where the teeth are touching each other, where they call them kissing cavities a lot of times, where one will get a cavity and now it can spread to the other tooth that's touching. We can catch things earlier before it has a chance to extend into those inside layers of the tooth. So how does a cavity start? So a lot of times we hear about eating sugar. It's not actually the sugar that causes the cavities. The bacteria that are in our mouth, just like when we eat, we create a waste. The bacteria can also eat what we consume, and they create a waste, which is acidic. And when that acidic waste is bathing over the teeth often enough, that is what takes the minerals out of the teeth. It starts to leach minerals like calcium and phosphate and creates weakness of the tooth. And that's actually how cavities are created. We're also going to look at gum disease. So gum disease sometimes is a general term that is talking about gingivitis or periodontal disease or periodontitis. And there's a difference between those two. So a lot of times when you go into your cleaning appointment, your dental appointment with your dental hygienist, they will take a ruler, a probe, and take readings around your tooth. You may hear your dental hygienist saying 2, 3, 4 as they're dancing this probe around the tooth. And what they're doing is it's a lot like if I would take this probe and put it between my finger and my fingernail. I just slide it in between that space because just like my fingernail is not attached all the way up to the top, the same thing is with the gum tissue around each tooth. We insert that until we feel a little bit of a resistance, and then we measure with those black stripes on the probe how deep that is able to go underneath the gum line. A healthy goal reading is 3 millimeters or less. That is because that is showing that there's good attachment of that tissue around the tooth, and it's a level that you can still access fairly well for keeping it cleaned out at home with your flossing and your brushing. If you start getting deeper readings, it could either show gingivitis, which is inflammation of the tissue, and that's where the tissue is puffing up and reading deeper on the probe, or showing signs of periodontitis. So if you look at that image on the right-hand side, the periodontitis is if the tissue gets irritated enough, it can start to separate away from the tooth. And as that pocket gets deeper, it gets harder and harder for you to clean that out at home. But the bacteria now have a nice little hiding spot in there that they can get into that pocket, cause more irritation. And if the bone that holds the teeth in place gets irritated enough, it can start to recede down. So you could have somebody that has never had a cavity before end up losing teeth simply because they lose that bone support holding the teeth in place. So what influences your oral microbiome? There are so many things. Genetics can play a part. Unfortunately, genetics is something that tends to be overstated by people. I can't tell you how many times in practice that I have heard a patient say, I just have bad teeth. Everybody in my family has bad teeth, and they just kind of resign to it, and they give up on trying to do different things because they just think that's what they're destined to have. But what is actually happening mostly is that it is their oral microbiome makeup. And the germs or the bacteria in your mouth can be passed from one person to the next. And that's why sometimes we'll see similar oral bacterial makeups within family members because of kissing, sharing utensils, sharing lip balms, all different things like that. It can be affected by your oral hygiene habits. How clean are you keeping your mouth at home? Your access to professional dental care. Also, diet and lifestyle choices are a huge factor. And then also medications and other medical conditions can play a part in your oral microbiome makeup. So what's really interesting is that we're learning so much about the oral microbiome now and how it's related to other health conditions. We are actually finding out that certain bacteria in the mouth can make people more susceptible to cardiovascular issues like heart disease or stroke, and also even erectile dysfunction by affecting those small vascularities. It can make people more susceptible to, and I just realized I have asthma spelled wrong in there, to respiratory infections. They've actually made a connection to Alzheimer's disease where they isolated specific oral bacteria in the brains of Alzheimer's patients. It has a reciprocal effect with diabetes, where somebody who's diabetic is more susceptible to having oral disease. But the more oral disease that you have, the harder it is to keep blood sugar levels under control, so they can get in a real vicious cycle. It can cause pregnancy complications. And what's most interesting is the connection that they're making between oral bacteria, your microbiome makeup, and susceptibility to developing certain types of cancers. So a lot of the cancers that they're making the biggest correlation to are ones associated with the digestive tract. So colon cancers, esophageal cancers, and even with lung cancers, but it's quite fascinating. So what's really exciting that now that we're making those connections, it's going to probably open up a lot of opportunities as we go along to find out. We can do testing on people now and see what kind of bacteria are in the mouth, and know who's most at risk for certain problems. And if something happens, we might find ways for better early diagnosis or prevention manners or even treatments. So as far as what kind of therapies can affect oral health, I want you to kind of think outside the box with this, because most people will assume right away, oh, we must be talking about chemotherapy. That does seem to be obvious. Also radiation therapy, of course, if it is in this region, but even if radiation therapy is in other areas, is it affecting your blood counts? That's now making you more susceptible to infection. Is it affecting movement in some way for somebody that maybe is having radiation therapy for breast cancer, and now their mobility on their dominant hand is making it harder to clean their teeth the way that they need to. And the same thing with surgery that can be affecting them. Hormone suppression is something that's going to be really relevant for this group. When you have a cancer that is driven by hormones, it's hormone receptor positive, part of the treatment is to suppress those hormones. Well, those hormones also play a role in healthy bone density. And for somebody that is battling bone density issues, that can make the bone that holds your teeth in can be affected by that as well. Also, hormone suppression can increase dry mouth and problems like that. There's a variety of targeted agents that can affect the oral cavity. Corticosteroids are sometimes used along with treatments, and those can also cause dry mouth and some bone loss issues. There's also anti-resorptive medications, which are the types of medications that are used to help keep bones strong, often used with people that are in more of an advanced stage that maybe have the cancer has spread to the bone. Often anti-anxiety or antidepressants can be used with it that often have the problem of having dry mouth. Some of them can have a really rare side effect where they make people more susceptible to clenching or grinding their teeth, which can increase risk for bone loss issues or breaking teeth. Diet can change, and all of a sudden, having a lot of Ensure or Gatorade or things like that can affect the oral microbiome as well. And then pain medications often make mouth dry. So the thing is, most people, when you're going through treatments, don't have just one of these. You have a combination of these. So every time you're adding another one of these factors into it, it just compounds your risks of having some of those issues. So my battle cry with all of my presentations is early intervention and patient education is the key. I think if we have the ability in the dental field to see somebody as early on in the process, kind of that golden window would be after diagnosis, but before treatments begin, we can kind of put the puzzle pieces together for them. We can look at their medical history, look at what kind of medications they're already taking and what other side effects may come with those medications, what the treatment plan is, what the risks are for those treatments, what their dental health already is, because somebody that goes into treatments that is really healthy to begin with in their mouth is just they're less susceptible to having some of these issues versus somebody that already has a lot of dental disease. And then we could put all these puzzle pieces together, figure out what they're most at risk for, and before the problems even have a chance to start making changes. And some of these changes, I think you're going to be surprised how simple they are. And that's what I really want to focus on, because a lot of these subject matter, these problems and the solutions can be so complicated, but there's some things that we can do that are so simple. So depending on the type of cancer and type of treatments, these are just some of the issues that can occur. But what we're going to really look at today is more dry mouth, because it is so common. Oral mucositis, which is the mouth sores. And then we're going to look at we're just going to touch on what's called osteonecrosis of the jaw. And that is for some people with these cancers that are more and more advanced stages, may be at risk for. So dry mouth is something that is very common. Unfortunately, sometimes is looked at more of being a comfort issue, but our saliva is really amazing, where it plays a role in lubricating the tissue, so it helps prevent wounds. If wounds occur, it plays a role in healing. It helps to buffer the pH, so we're going to be talking a little bit about acidity and the role that a saliva plays in that. So it helps to remineralize teeth, which will make sense as we go through. It's the first step in food digestion, and it also plays a role in taste. Taste changes is a common complaint, and there are certain receptors on your tongue that are dependent on saliva to function properly. So the drier your mouth is, the more likely that you will have problems with taste changes. Some simple tips for a dry mouth, really staying hydrated, avoiding caffeine and alcohol because those can be very dry. Avoid dry, crusty foods and try to add more moisture to your diet with lots of sauces and gravies. Breathing through your nose, that might sound kind of simple, but if you are a mouth breather, you can do all these different things to try to remedy your dry mouth, and it is going to be a tough battle for you. So if you think of lips together, teeth apart, and breathing through your nose, that is the best way to help keep moisture inside of your mouth as well. And also using a humidifier can be helpful, especially at night. There are a lot of products on the market to help dry mouth, and there are more and more that are coming out on the product or on the market because manufacturers are taking a note what a big issue this is. Keep in mind, there's no one size fits all. And if we talk about products a little bit later, I wish there was a magic bullet. And I could say, boy, this is the one thing that everybody should use and you're going to have great results with it. It's just not reality. Some of it is just needing to be open to trying different things and don't give up. You can get different recommendations. If you find something that doesn't work, try something else. And there's lots of options out there to try. And think of the long-term effects though. Just like when we talked about those lemon drops earlier on in the program and how that was giving the relief of the dry mouth immediately, but unfortunately was going to contribute to damaging teeth later on. There are products in the market that can also do the same thing. So make sure those products that you're using are recommended by a trusted dental professional. So I want to go through oral pH and oral diseases. A healthy pH range in a mouth is around 7, which is considered neutral. And every time we eat or drink, our mouth goes through an acid attack where that pH plummets to a lower level. And that's where demineralization takes place. That's when I mentioned like calcium and phosphate starts to leak away from the tooth structure and it starts to weaken the teeth. In a healthy mouth, what happens then, saliva comes in and starts to remineralize. It starts to bathe the mouth with those healthy substances again that puts calcium and phosphate back into the tooth structure. So our teeth are basically remodeling constantly throughout every day, throughout our lifetime. So it really does take a healthy saliva to help keep that remineralization process happening. So it's important to know if you're using certain oral care products, look at what the acidity levels are. It's kind of frightening when you look at this. This is a study out of the University of Florida done in 2018, I believe it was, where they tested 11 dry mouth lozenges. And out of the 11 lozenges, they found that only 2 were considered in a safe range, that they were not acidic. So if you think of it this way, if you're using acidic products, if you're drinking a lot of acidic beverages like soda and things like that, you're just cutting out the middleman. You're not having to feed the bacteria to create the acid. You're just putting the acid right on your teeth to damage the teeth. So it's important to use products. You want to use them that are close to that 7 range, maybe sometimes even a little higher than 7 into that more alkaline range to help balance that pH inside of your mouth. And this is a list that I borrowed from a company called Carry Free. It lists a lot of different mouth rinses and what their pH is. So this is one I like to use it just as an example of what some of the pH ranges can be. But please take this list with a grain of salt because products change. You can have a company that will keep the same formulation, but they change the name of the product, or they may keep the same name and change the formulation. So there's no way to say with these lists how long they will stay accurate. But this is something just to be aware of, that because you would assume that all products that are on the market are going to be good for your teeth because they are considered oral care products, but that is not the case. For oral mucositis, treatment and prevention are really aimed at reducing risk factors that we can change. So certain people are just more susceptible to developing oral mucositis. Females are more susceptible than males. The extremes of ages, so the old, very old, the very young are more susceptible. The extremes of body mass indexes, so the very large or the very thin are going to be more susceptible versus that middle range. Even certain races are more or less susceptible than others. And we really don't have control over those things. So what we want to do is look at the things we can control. And those are treating dry mouth, making sure that tissue is lubricated and reducing that risk for tissue trauma. We want to address any existing dental issues. And that's where that value of seeing somebody before they begin treatments is so valuable, because that allows us to remove anything that may be an irritation to the tissue. That could be an ill-fitting partial or denture that we could adjust. It could be a broken tooth that needs to be removed or smoothed. It could be existing cavities. It could be infections that we need to take care of. Anything that could cause an irritation. And also poor oral hygiene can play a part. This is where people can get into a real vicious cycle as well, where if your tissue gets tender, all of a sudden it becomes hard to brush. And then if you stop brushing and you get more of that bacterial buildup, it's called a bacterial burden, and it starts to create more inflammation, and now you're more susceptible to mouth sores again. So it's important that even if your mouth gets tender, that we find ways that you can continue brushing, and I'll give you some suggestions for that. So medication-related osteonecrosis of the jaw is a rare condition, but it's something that is a chance to happen for some people. Basically, it's an infection in the jawbone where the jawbone can start to die. There are certain medications that can put us at risk, most notably what are called like the bone modifying agents, which are like Xgeva, Zometa. Also, some targeted therapies can put us at risk by reducing that blood flow to the jawbone. The signs and symptoms we want to look for is like this heavy feeling in the jaw, pain in the jaw, drainage, exposed bone is a big one. Most of the cases are initiated by some type of trauma. So about 75% of cases are going to occur because of something like a tooth extraction or some trauma to the jawbone that initiates that response. And that's why prevention is considered our main goal. So if we know somebody's at risk, and again, the risk is low, but it's real. So if we know somebody has even the slightest chance of developing this, let's focus on prevention. Let's look at making sure that they know what to look for, that they notice some of those symptoms, that they are having that checked out sooner rather than later. Because the more advanced it gets, the more reduced that we are on the medical and dental team on what we can do to help remedy that. And keeping the mouth as healthy as possible, reducing any need for extractions or problems like that. And part of that is really having really good communication between the patient, the oncology team, and the dental team. Treatment options can be limited. So, and some of them can be very expensive. So it is really something that we want to look at preventing rather than trying to put fires out when they begin. So some of the things we can do, simple things. I'm going to go through these kind of quickly because I feel like I was a little long-winded with some of these things. Looking at your toothbrush, we want you to use an extra soft compact head toothbrush. A lot of toothbrushes on the market are huge. The bigger the brush that you use or the stiffer the bristles, the more likely that you are going to cause trauma with the toothbrush, and the more likely that you are going to not be able to access really tight areas in the mouth. So you want to use something that's smaller, compact head, sometimes even a child-sized brush, and an extra soft toothbrush is going to help making brushing more comfortable if the tissue starts to get sore. And it also reduces the risk of like cutting into the tissue or causing any irritation if that tissue becomes real fragile. The softer the brush, the faster it's going to wear out. So you do want to replace that brush at the first sign of any bending or fraying of the bristles. And that may be more than you're used to, but that's okay because that allows you to not have a lot of bacteria to build up on your brush, because it's going to be another place that bacteria gets introduced, especially you want to avoid that if you have oral mucositis with the open mouth sores. So part of that is protecting your toothbrush from germs. In the picture, I've shown a cup where a lot of times you walk into people's bathrooms and all the family members' toothbrushes are sitting together and touching each other. You want to avoid that when you're going through treatments. Just be protective of your oral care products in general when your blood counts are low. Keeping your toothbrush away from touching other people's. Sometimes there can be these protective disposable covers you can use that protect it from contact contamination, and you just throw it out and put a new one on. It's just disposable, and it helps to dry the toothbrush out. And just remember, don't share anything. Don't share a toothbrush with a family member if your blood counts are low. Don't share lip balm. Don't share unwashed cups, utensils. And also, I like to just mention it's a good idea to use your own tube of toothpaste, because if you are putting a ribbon of toothpaste out and you dip the end of that on your toothbrush bristles, now technically the end of that toothpaste tube is contaminated and can spread germs from one family member to the next. So that's a simple way to protect yourself. Also, avoiding certain product ingredients. So there are a couple detergents that are common in toothpaste, especially in other oral care products. The most common is going to be sodium lauryl sulfate. It's a sudsing agent that gives the product a nice sudsy, thick feeling, like you're really cleaning well. The only problem is it is a skin irritant for somebody. So for anybody that's susceptible to a lot of dryness in their mouth, a lot of susceptibility to oral mucositis, that can be a tipping point for them. So you want to avoid sodium lauryl sulfate. And some toothpaste that take a sodium lauryl sulfate, replace it with another one called cocamidopropyl betaine, which has also been shown to be a skin irritant in some people, so much so that it gained this goofy award back in 2004 from the American Contact Dermatitis Society as Allergen of the Year. And they found that the majority of allergic reactions tend to be in the head and neck region. Avoid drying and irritating ingredients like alcohol, whitening products, tartar control, and strong flavors. If you have tenderness in the tissue or nausea, mint, or anything that's real strong may feel too sharp to you and be a trigger for that. So there are a lot of options that are coming out that are very mild flavored, non-flavored, or sometimes even a children's flavor can be beneficial. Look at how products are sweetened as well. There are a couple sweeteners that are, these are natural, natural sugar substitutes. And the most common you're going to see is xylitol. There's also erythritol. For xylitol, just use that as an example, that is created from fibrous materials like corn cobs or birch trees. What they found is it actually helps to improve your oral microbiome. It helps to buffer the oral pH, and you want to have 6 to 10 grams a day with about 5 exposures a day, which sounds like a lot because, you know, who wants to add something 5 times to your day? But if you just, it comes in toothpaste, it comes in rinses, it comes in dry mouth gels and sprays. And sometimes just switching the product that they're using that has like a xylitol or an erythritol base can help you to get those 5 exposures a day. It is digested as a fiber. So if somebody has never used xylitol before, and all of a sudden you really switch fast and you use a bunch of xylitol, your stomach may get a little irritated with that. So it's good to just introduce it slowly into your routine. And that helps to let your body adjust so you don't have any issues with that. It also has a low glycemic index, so safe for diabetics. It is important though, if you have any xylitol-based products, keep them away from your pets. Just like raisins and grapes and chocolate are fine for us, but not for our pets, especially our dogs. Xylitol is highly toxic to dogs. Fluoride is a hot topic right now. And the reality is fluoride does help strengthen teeth. I want you to just, my goal really isn't to convince you one way or another as far as your opinion on fluoride. However, I do want you to, when you're looking at things in the news or you're getting opinions on both sides, keep in mind a couple different things. Are they talking about a systemic delivery, which is like drinking it, getting it in your water supply, or a topical delivery where you're just brushing it on? Those are 2 different ways that your body are going to process it. There are over-the-counter concentrations, which are much less potent than the prescription gels and rinses. Sometimes people have trays made before going into treatments, which are wonderful. They're really helpful for protecting teeth. The reality is sometimes using those trays during the treatment process it's not reality. Sometimes people just cannot tolerate them because of nausea, because of mouth sores or irritation like that. So I usually tell people, if you start out with trays and all of a sudden it gets to be a little irritating for you, there's nothing wrong with just backing off for that time being. start brushing it on. And when you start feeling a little better in that cycle of your treatment process, start using it again. And you can go back and forth and you're still going to get some benefit for it versus just giving up on it altogether. But even if you get a prescription fluoride gel or things like that, check it also for those other potentially irritating ingredients, especially that sodium lauryl sulfate detergent. There are also new options out in the market of probiotics. Just like you can take a probiotic for gut health, you can actually get oral probiotics that introduce the healthy bacteria back into your oral environment. So I have some at home here that's basically a little lozenge that I suck on, and it helps to introduce that bacteria again. And those are different than the type that you would take for your digestive health. You really do need to look for something that is more designed for the oral cavity. There are also things that are ingredients that are considered prebiotics that help to feed the good bacteria to help them make them stronger and let them become more abundant in your mouth. So this is a saying that I worked at the last office that I worked at. I'm no longer practicing clinically, but I worked 20 some years at that office, and I got to be very close with a lot of patients and their families. One of the ladies that was a longtime patient in our office had started treatments for breast cancer. And when she was able to come back the first time, once treatments were done, she said to Jill, "I'm so scared what you're going to find." She said, "There's so many times I did not want to brush." She said, I was nauseous. I was tired. The last thing I wanted to do was stick a toothbrush in my mouth. She said, "But I kept remembering what you told me." And I would motivate myself by saying, "Just do it. My hair will grow back. My teeth won't." And that always just struck me. And it still does every time. And that I have this on a slide because it is so true. I never want to minimize the effect that losing hair can have with somebody, but it will come back. And sometimes it's going to come back curlier and more fun than it was before. But your teeth won't. And if we put as much focus on preserving teeth as we do about worrying about hair loss, that is a very temporary thing, what a difference we could make for people in the quality of that treatment process and in survivorship. So this is my information. You are more than welcome to reach out to me anytime. I've got some key takeaways listed as well, and happy to answer some questions for you.
Thank you so much, Jill. We got so many questions with registration, and we're getting so many questions live as well. So everyone, just so you know, because I know we're not going to be able to get to all of them, so I've already spoken with Jill ahead of time. So anything that we do not get to, we are going to make another pre-recorded video just answering those questions, and we'll get those out to you in a few weeks. Okay, so let's get to it. I know you mentioned like certain chemos, etc., can cause a lot of risk. So like for me, I was on ACT. I've got some people here mentioning polio, and they're wondering, does that add an added layer of risk of ONJ when trying to maintain oral health?
Yeah, so the Prolia is a lot like that is one of those bone modifying agents or the bone resorptive inhibitors that I mentioned about trying to keep bones strong. In general, you're typically going to see those used in like the metastatic breast cancers or something that has actually affected the bone. And they're amazing medications because they help to reduce risk for what are called skeletal related events. So they're going to reduce risk for bone pain. They're going to reduce risk for bone fractures, spinal compressions. So they're such important medications. It's just one of the risks that can come with it. So again, if we know that somebody is taking a Prolia, an Xgeva, a Zometa, recognizing that it is a risk. So let's do all that we can to keep everything as healthy as possible, making sure your dentist is aware of that. That's probably one of the biggest things that is important. Your dental providers know that medication is part of your treatments and that risk is there because that's going to affect their treatment plan for you or what they recommend. And sometimes even if you do need an extraction, then the steps that they can take to hopefully help to reduce your risks of having it occur.
So Jill, do you want to stop sharing your screen so we can
Oh,
see each
yes, sorry
other?
about that.
Yeah. Another question, and so you did kind of allude to this earlier with AIs, and especially if your cancer was driven by hormones, um, like, is that a side effect to have that pain and discomfort even in, quote unquote, post-treatment on AIs?
Um, Everybody's so different.
Mhm.
That's the one thing, and I wish that I wish there was a way to say that, for sure this will happen or this will happen. And I think a lot of that can depend on too is the person's dental health to begin with. I think somebody in general that has gone in that's had a lot of issues
Mhm.
beforehand, they're just going to be more susceptible to having not only the problems during the treatment process, but also, into the survivorship years of noticing this kind of lagging long-term issues. So that for some people is just, it's hard to get out of that cycle. So that's why I really too like to focus on some of those simple things. Making those simple changes, then it's not so intimidating, and if you keep doing enough of those simple changes, it can help to slowly get breaking that cycle for people. But I don't know if that really answers it well, but it definitely different treatments can have kind of that long-term effect.
Um, so if I freeze a little, my laptop's telling me I'm unstable. My internet's telling me I'm unstable. I don't like that message. Anyway, so another question, and I saw some multiple questions regarding, now I don't know how to quite say this word, but you may figure out what I'm trying to say here. The nanohydroxyapatite?
Nanohydroxyapatite.
Oh,
Yep.
okay, I was getting there. So we actually had multiple questions regarding that. Like, um, it's thinned their teeth and gums, and does that help rebuild enamel?
That is an alternative to fluoride. So when you have people that are uncomfortable using fluoride, there is a growing number of products that are um, that that contain nanohydroxyapatite that can help to remineralize teeth. There are some that contain both. They'll combine the nanohydroxyapatite and a fluoride to help kind of give a double bang for more bang for your buck with that.
Mhm.
So that is something is definitely an option. You do have to be a little careful because there's a nanohydroxyapatite and there's a microhydroxyapatite. So the effectiveness of how well it's going to remineralize the teeth has a lot to do with the shape of the particle. Um, so it can get really, really tough with knowing one product to the next. And I think that again is a great way to stress the importance of having that good relationship with your dental team and asking them questions about products, and I think they're changing so often. It's hard for providers to keep up on it as well. So getting those questions from patients, I think is wonderful because that's the best motivation to put something on your provider's radar that maybe they hadn't thought about before or weren't aware of, that they can look that up and get you better information, be better prepared for their other patients in general.
Well, to kind of go off of that, right? Um, we've got a lot of questions here, such as like, how do you even find a dentist that specializes in cancer patients, or what kind of questions should we be asking? Because this also comes down to like an access issue too, right? Because for many of us, we have health insurance, but may not have dental insurance, which
Mhm.
is, nuts right there, right? Because dental is part of health. So what kind of questions, or what should we say to dentists, or try and find one that is specialized in cancer patients, but also if they're not, like one of the questions we received, um, this person's been on anastrozole for a few years now, and they've noticed like an occasional aching and discomfort in their gums and teeth. They feel it's related to their AI, but their dentist is like, hey, you're fine, you're okay. Like, what are some questions that we can ask?
Um, yes, and this is one of the frustrating aspects for sure. And actually one of the reasons when creating side effect support, I didn't want it to just be focused on a resource for patients. I want it to be focused as a resource for providers, because this is something that we as dental hygienists, as dentists, learn very little about in this area in dental school. But on the oncology end as well, I've had physicians sitting in my dental chair saying, "Don't talk to me like I know anything. I've spent like 2 days on learning them all." So that is something that, there's just that lack of information altogether. So I do have sections on the website that help to make it easy access for providers that are willing to learn more. I think it's great to question your providers if they do have um, any extra education in this area, and let them know, hey, if you're interested in learning more, here's a resource for you, because I can give them good connections to other outside resources as well, that they know that they've got the documented, most up-to-date information. So part of it is going to find a provider that, number one, is motivated to learn more. There are more opportunities now, like your dental hygienist. There's an organization that I'm part of called the National Network of Healthcare Hygienists, and they actually have an oncology program, a certificate program that a hygienist can go through and learn more all about oncology and better ways to help their patients. So there's better resources out there, but this still is a lack. So, and of course, it depends on where you're living too. Like I live in rural Wisconsin. My resources for finding a dentist that has extra information and training in this area are a lot less versus somebody that's living in a big city, and especially maybe has a hospital where they're getting treatments that is an integrative hospital where they're integrating, dietitians and maybe psychologists, and all these different things into the care program, that a dental team may be available with them as that as well. So there are also some options if you are seeing a dentist and you're having trouble with getting coverage. There are some people that I know as well that help dental offices learn how to bill through medical. It's not always successful. Sometimes it is just having that dental office be willing to think outside the box and follow through with some of the extra steps that they may need to do. But if that is something that people are struggling with as well, I would be happy to help make some introductions for people. And there are other organizations. There's a great organization out of Massachusetts called MAPS. It's the Massachusetts Oncology Patients and Providers. I can't remember what it all stands for, but it's an advocacy group that is actually introducing bills to their legislation to help get coverage for cancer survivors who have had dental health damage because of their medical conditions, mainly cancer. So they are running into some issues, but you do have some organizations that are trying to spearhead this. So any support that you can give an organization like that, I think the farther they get in their state is going to help you to make some access or get some access in your state as well.
Wow. I mean, that's very encouraging that this is finally getting the attention that it deserves. Right, because I also suffered from mucositis as well, so I definitely understand the pain. Let's see. So you had mentioned earlier about like the toothbrush and the making sure it's soft and the toothbrush size of it, but what about electric toothbrushes? Because I have noticed that those have gotten smaller, the smaller heads as well. And also with that, what do you recommend for flossing? Like one of those pick things? How frequently should you be doing it?
Um, the well, and one of the ironic things is that many times patients are told when you start treatments, sometimes they're told don't floss by their oncology team, with the thought process that they may cause trauma and introduce bacteria that can introduce infection and bacteria risks.
Mhm.
It's very counterintuitive, but the fact is, if somebody's not been a flosser, starting it in the middle of your treatments is not the time to do it, because you're probably going to be causing bleeding. And if your platelets are low, you could have uncontrolled bleeding. If your white blood counts are low, you could introduce bacteria that may cause infection that could spread. one of the biggest things is using the proper technique. So I have some floss here. What you want to do is take about 18 inches of floss. Sometimes people take these little tiny pieces, but don't be stingy with your floss. Take a nice big long piece and then wind it around your middle finger on one hand, like once or twice, just enough that it's holding on tight. You're not going to fall off. And then take all the rest and roll that around the other side. And now you can use your pointer fingers and your thumbs for extensions. And that's going to help to reach, especially in the back, without jamming it up into your gums. Because a lot of times if people go like this, then all of a sudden it's a tight spot and then they get through and all of a sudden it jams up into the tissue and now it can cut the tissue. So if you fulcrum yourself like that, where you're bracing yourself, you'll have a lot better control over it. But once you get in between the teeth, what you want to do is take the floss and curve it like a C shape. And then gently go up and down that whole inside edge of the one tooth, and then flip it over to the other side with a C shape and go scrape that inside edge of the other tooth. You want to avoid going straight in and seesawing, because at that point, you're not actually cleaning those inside edges, you're just sawing into the tissue. So get that curvature, really rub up and down the other side. And then that's going to be your most effective way of flossing. And if you're curving it real tight, you're going to be able to get into that little space underneath the gum line to help keep that cleaned out and reduce any of the bacteria that's building up in there. Once you use this spat, wind that around and keep winding it as you're using it. So you're always going to a fresh area of floss as you're going around your mouth. And that helps prevent that you don't have bacteria plaque from this area and just spreading it to the next.
Oh my gosh, you should see the reactions that were coming over of like hearts and like celebration, because I don't think many of us even really knew that, especially, because I remember my oncologist saying, don't floss when you're starting chemo. So thank you for that. Very
Yeah.
awesome information. And y'all, we're going to make sure that we like really highlight that demonstration there. So you don't recognize
Oh, the picks.
recommend the picks. Yes. I was like,
I actually like the picks too, but that is the hardest thing, is getting that like curvature. So sometimes too, it's just while you're using it, watch yourself in the mirror and push it to one side that you're scraping that inside edge of the one tooth and then pulling it to the other side and not just going straight in. Especially, if people have even a little spacing between their teeth or they're not perfectly straight, then you end up missing those areas. So then you're not being effective with flossing. And of course, if your blood counts are low, you probably do need to hold off on flossing during those times that you are more susceptible to having some problems with it. But a lot of it's practice. It takes a little bit to get your fingers coordinated to do that. But ideally once a day at least would be the best, just because it takes a little time for that bacteria to come together and colonize and form that plaque. So once a day at least, you want to get in there and disrupt it from sticking onto those inside edges of the teeth.
especially if you have neuropathy in your hands too. So I do like the curling around to make sure it's really on there. All right, so we're getting close to time. I'm going to So a quick question here. Should root canals and extractions or any type of major work such as crowns or caps should you avoid those during chemo? If so, when's a good time to consider those if you have completed treatment?
For a lot of people too, they'll not only be told, don't floss, they're probably going to be told, if they're going to have a lot of issues with low blood counts, to not see their dentist during those times. And again, it's one of those things that seems so counterintuitive in some ways, but the concern is just having that uncontrolled bleeding or an elevated risk for infection. So there may be times that you can time out your dental appointments. So when you have your treatments, usually about 7 to 10 days after your chemotherapy infusion is when your blood counts are going to plummet to their lowest. And then they're going to start climbing up and get to just about normal again when you have that next infusion. So sometimes you can actually time out your dental appointment, and your oncology team would help you do that to say, this is my safer window of time to see my dentist. And just making sure that you're being seen on a regular basis, that again, if things do have start, that we catch them early, but a lot of it will just depend on your blood counts. There are situations like if it's needing a root canal and there's infection present, that's something you want to have a serious conversation with your dental team and your oncology team and make sure that they're communicating with each other, because you don't want to avoid a root canal and leave an infection in there, even if it's not bothering you, because that can spread to other areas. There's no reason in the world that an infection in your mouth is going to stay contained there, especially when your white counts are low. That could be a reason that sepsis would occur.
Mm. Well, uh, again, we're still getting a ton of questions. So everyone, again, I am going to get with Jill later. We're going to go through the remainder of them. So don't be discouraged if your question did not get asked. Jill, you're getting a lot of love in the chat
Good.
that this has been so incredibly helpful. So we really want to thank you for your time, your expertise, your demonstration, and the fact that you truly do understand cancer patients and what that can do to the mouth. So we so appreciate your time today. And everyone, thank you so much for joining us. And hold on, let me get down here. So just a few quick reminders, y'all, as we close. We again want to thank every single person that was here today and for bringing your voice to this space. You're an important part of our community, okay? And we're grateful you're here, but a few quick reminders for you. This recording will be available on our website in a few weeks, but we will share the Facebook Live link so you can see it quicker as well. And we truly value your feedback. So as soon as this webinar ends, you're going to see a survey that pops up. Let us know how we do. What do you want to hear more of? You want to hear from Jill again? I know you do. But let us know, because your input really helps shape our programming. And again, on behalf of Share, thank you for trusting us with your time and for helping create a community where no one feels alone. Thank you, everybody. Have a great rest of your day.